Before discussing how to fix a broken nose, first a little anatomy lesson. The nose is actually composed of cartilage in the lower half and bone in the upper half. The nasal bones and cartilage can be more clearly seen after the skin and muscle have been removed. The cartilage is in light blue. The bone is what's left over after the cartilage has been removed. You can feel where the nasal bone begins and ends on yourself by running a finger down along the side. Where the finger suddenly feels a hard edge halfway down the nose marks the inferior border of the nasal bone. As such, surgical correction of a broken nose does not refer to nasal deformities of the bottom half where only cartilage is present, which may require a nose job to correct. Only the nasal bones in red involving the upper half of the nose is amenable to a simple nasal fracture repair. To fix a broken nose with only local anesthesia without sedation, lidocaine containing epinephrine is injected into 3 areas of the face where nerves supply sensation to the nose. The first injection is to deaden the nerves that come out over the cheek. The next injection is to deaden the nerves that come out near the eye. The final injection is to address the nerves that come up from the upper lip. In order to address the nerves that supply sensation inside the nose, a copious amount of lidocaine is sprayed into the nose, not just near the entrance but also deep inside the nose. A nasal decongestant spray like Afrin is also sprayed to minimize risk of a nosebleed. After a period of time to allow full local anesthesia to take effect, a device without any sharp edges is introduced into the nose and directed to the region where the nasal fracture is located. By applying firm pressure both with the fingers and using the device internally, the fragmented nasal bones are physically pushed into straight alignment. It is not unusual for a nasal pack to be inserted into the nose and placed under the fractured nasal bone to provide internal stability. This can typically be removed within 7 days. After the nasal skin is cleaned, an external splint is then applied to the outside of the nose to provide further external stability, but also protection from further accidental trauma. External nasal splints are ideally kept in place for a minimum of 2 to 3 weeks before removal. Tape is applied to further secure the nasal splint to the cheeks.